Hi, everyone, and welcome to our third master class, Using Storytelling as Advocacy. And this master class is presented by Scott Darius, who is a graduate of the University of Florida's College of Law. He's the executive director for Florida Voices for Health, a nonprofit advocacy coalition dedicated to creating a more accessible and affordable healthcare system through storytelling and civic engagement. Florida Voices for Health uses the model engage, organize, mobilize to successfully connect constituents and stakeholders to the key decision makers in Florida who are driving health policy, legislation, and administrative rulemaking. The policies, laws, and rules are described as the political determinants of health in the model of health that we're using for this health literacy masterclass series. The political determinants of health are the upstream factors that drive the distribution of money and resources into communities. Please remember, too, that the definition of political that we are using is the simplest definition, and it's how groups who live in a society work together to get things done. We know that our democracy works best when citizens engage actively with elected and appointed officials to express their needs. This process is called advocacy, and Scott's presentation will teach you how to turn your personal experiences into powerful tools for advocacy to influence systems change. Scott, thanks for joining me.
Dr. Geyer, thank you so much for having me. As we kick off, thank you again for a great introduction, and it's an honor to be here and to share this space with you all. Just to dive a little bit deeper, to give a little bit of more context about Florida Voices for Health. Like Dr. Geyer mentioned, we're a statewide health advocacy organization, and our mission is to improve access to healthcare for low-income and middle-income Floridians. But I think the truth is, regardless of how much you make, anyone who's had to interact with our healthcare systems understand how difficult it can be to get the things you need sometimes, especially as you need them. And so our mission fundamentally is to improve the system for everyone. We focus on a couple of different areas: strengthening the Medicaid program, improving access to oral health, and improving access to supports and services for people with disabilities. But as you can imagine, there's a lot of overlap and things cross over all the time. The way we do that work really boils down to two things. One is coalition building. And so we're very fortunate to work with a lot of great partners around our state, but also across the South as members of a coalition called Southerners for Medicaid Expansion. But really at the heart of what we do, at the heart of who we are, it's storytelling, like you mentioned. It's empowering people to share their stories for themselves, hopefully in those spaces where they can make a difference, whether that's in front of legislators or at the podium of a press conference, or just expressing themselves at community meetings or letters to the editor, any number of ways to use the power of voice. And so, yeah, our goal is really just to put people in those positions where they can do that.
And Scott, what I love about your work is that you make it easy for people to get involved with advocacy because everyone knows their story. And what could be more normal and logical and easy than telling somebody your story? So to know that telling your story can make a powerful difference and move the hearts of lawmakers and policymakers in the direction that's important is really exciting news.
Yeah, it's funny how many times you have to convince someone that they don't need some special expertise, that they don't need
Right.
some like deep education in this stuff. And it's no, your story, your lived experience actually gives you all the credibility in the world
Right.
to be in any space. Yeah, that story could have some impact. Whether you're talking to doctors or people who are right, like kind of at the end of their rope. Yeah, it's kind of the great equalizer, being able to share your story, that everyone's story matters and that
Mhm.
everyone's story can have impact if used in the right places, at the right times, in front of the right people. Yeah. And hopefully that's what we'll dive into a little bit today, right? As we go through the presentation, I think the goals of our conversation, but also the little bit I'll share through slides, it's really giving people the tools to craft their own personal stories to make them sharp and effective, compelling, but then also how to leverage those to do systems advocacy, right? And I'll talk a little bit about the differences between, yeah, the advocacy we do as individuals, but yeah, the advocacy we do as individuals, but also systems level advocacy. And then hopefully just to share a couple of tips about how to avoid some of the pitfalls, right? Some of the things that take away from the power that stories can have in any particular setting. To start, I think it's worth teasing out this difference as we talk about advocacy, right? Between personal and individual advocacy. So, where, let's say, as a patient in a hospital, right, you need a particular treatment or something paid for, and yeah, you advocate for yourself. You advocate for your needs for a particular test or whatever it is with that individual doctor or whoever is making the decision. But there's this larger advocacy, which is what I think is at the heart of this presentation. It's about systems, right? It's about big picture, the policies, the laws, practices that we're trying to fundamentally shift to help and support an even greater number of people who we know are being impacted by those things in one way or another. And yeah, and that's the work Florida Voices does. It's a lot of the systems level advocacy. Surely, when we have people come to us with stories, individual stories, people come to us when they're in a time of need a lot of times. And so we try to step in and do and support them in that personal advocacy. But we always try to tie it back to, hey, you're likely not the only person facing this particular challenge,
Right.
or this challenge exists because there's a flaw in the larger system, the larger set
Hmm.
of laws
Right.
that are keeping you from the things that you need. And what can we do to address that? And your story can be a powerful piece in changing, yeah, the overall system as it exists.
Hmm.
But why does systems advocacy matter in the South, right? I think if you live and you work across the South, you probably see and understand the need for systems level advocacy. Yeah, you probably get that very intimately, I'll say. Unfortunately, in healthcare, it really doesn't matter what lens you look through. It's clear that our health systems, just as they exist now, are leaving a lot of people behind. As you look across the South relative to the rest of the country, people are more likely to be uninsured or have no don't have a usual source of care. And this is on top of having high rates of chronic diseases like diabetes and heart disease. But then you look within the South and we see how residents of rural communities are facing worse outcomes than in more metro areas. And then
Mm.
unsurprisingly, I think those disparities also show up when you look at the differences between racial and ethnic groups. And I'll close out the section by saying that while I include the specific example here of Medicaid expansion in the context of why we need advocacy across the South, I think it also makes the general point that there are a lot of political opportunities or policy opportunities that just don't move in the South for one reason or another.
Right.
And I think we have, a sense of what those reasons are. It's just clear that there's a lack of political will on the part of lawmakers across the South to tackle these big issues, all the things that are listed out here and so many others, right? When it comes to healthcare, housing, education, all of the big solutions for the problems that we're facing. And yeah, again, expansion is just an example, but across the South, I think there's a need to do systems advocacy to really
Hmm.
address all of these things, to create that political will. So yeah, that's what I hope our conversation leaves folks with. It's a sense of how storytelling can help build that
Right.
political will that feels like it's lacking. And then together, each of us as individuals, as organizations, in our own places across the South, our own, slice of the pie, that we can grow a movement together, right? Working individually, but
Right.
in step. Yeah, on a movement that's focused on improving the lives and outcomes of people who are enduring, unfortunately, the highest outcomes in all of these outdated systems.
Hmm. Scott, I want to mention too that advocacy really is education. And when you were talking about, again, living in the South and sometimes certain kinds of issues are more difficult to move with regard to policy and legislation, I think it's important for us to remember that it often boils down to education and being willing to take the time, find the time, right, to visit with lawmakers, visit with policymakers, let them get to know who you are. Um, and share not only stories, but share educational information with them through the stories that you tell, because that's what they're going to remember.
Absolutely. And I think what you hit on there is the value of relationship, right? That
Right.
what we'll talk about is how to build a story, how to share a
Mhm.
story. But I think the kind of underlying truth, a fundamental truth in being effective in storytelling is that it's a lot easier for the information you're sharing to land
Right.
when it's built on relationship. And that's easier with some folks than it is with others, right? But it's still the work that needs to be done is finding a way to connect with people and then using that connection, that
Mhm.
relationship to share those
Right.
stories. Hopefully they land.
Well, that's why you build a coalition, right?
Yeah.
Because those folks that might be easier for me to communicate with. Maybe we have some shared interests. Maybe my granddaughter goes to school with their grandchild, okay, or something like that. So, there's somebody for everybody. And when you connect coalitions and you work with other people, you can then say, well, these are the folks that I know. And I would like to spend time getting to know them and educating them. And who do you think would be, a good match for some of these other policymakers? So, it's about sharing, right?
That's the best practical tip, right? Like that it's a lot of this work we can't do alone. Storytelling, whether it's identifying individual storytellers or in the sharing of it, it's
Right.
better done in coalition, in partnership with other folks, because that's how you get it to land. That's how you get it in the places where you'll stories in the places where
Mhm.
they need to be. So yeah, you're spot
Right.
on. I'll say that my story, my journey, kind of in understanding the value of storytelling, actually begins with my friend Ralph, the anthropologist. So Ralph, in the years going to school, we were all going to school. He went to a more, non-traditional undergraduate program at Hampshire College. But as he was pursuing anthropology, and he and I would talk back and forth, he'd always go on and on about how storytelling is at the heart of the
Mhm.
human condition and that, and I just
Right.
never listened. But here I am now, and I'm telling you that Ralph is right. You guys don't tell Ralph that I said he was right, but it turns out that telling stories is something that every one of us done or does and likely have done recently. um I came to understand the reasons that human beings tell stories at all. uh Instead of, as an example, right? Instead of just telling a friend that we understand, maybe they're grieving, and instead of just telling them, hey, we understand the situation that you're in, right? Just kind of as a natural reaction, we'll tell a story about a time where we grieved a very similar situation as an attempt to
Right.
connect with folks emotionally. And these are things,
Hmm.
again, these are things we all do, but maybe haven't like thought about why we do them or what's actually at play, right? We just kind of,
Hmm.
as a
Right.
natural reaction, say, hey, I actually understand. I've been in a similar place. Here's how I got through it. And you share and connect on that level. Sometimes instead of boldly declaring that you're a fan of the Florida Gators, which I say here in this setting, knowing full well this is going across the SEC. We talk
Right.
about how, watching Tim Tebow beat Alabama in an SEC title game completely changed our life. And yeah, that's an attempt to declare our history and hopefully guide
Hmm.
others. Uh, Sometimes, instead of just saying we hold a personal belief that people should have access to healthcare, we start by telling a story about a family member, someone we knew
Hmm.
personally who was working very hard, who maybe didn't get the access to care that they needed and faced, yeah, a poor outcome because of it. And in that way, we really show what our values are, but also how we landed at that value, how we make decisions in
Hmm.
the world, and how
Right.
we think about the things around us. And so, again, it's the most natural thing we do as human beings is to tell stories.
So much better than statistics. And I think probably lawmakers and policymakers are going to remember a personal story with human interest over some dry statistics, right?
Absolutely.
Or
And just
graphs
to
or charts. Yeah.
And to that point, right, it's not to devalue the use of those statistics
Right.
and data at all, right? It's how do you marry those two things? How do you,
Right.
because yeah, statistics alone, someone points to it and says, oh, well, they create a narrative in their minds, right, about why those people have ended up in this situation. If you say, hey, this community is facing a higher rate of diabetes, then people will just say, oh, they need to eat better. They need to take better care
Right.
of themselves, right? It's the narratives that allow us to build a nuance, to paint a true
Hmm.
picture of what those numbers are telling us. And vice versa, actually. If you tell an individual story, right, how easy is it for someone to walk away from that saying, oh, well, that's just one person. So, yeah, what does it matter to me? Again, and that's where data shows that it's, hey, it's
Hmm.
not just one person in the situation. This is actually a systems level issue that we all need to address. And
Right.
so, to your point, Dr. Guy, I'm so happy you mentioned it. It's those, how do we find how do we find ways to make those two things work together? And that's,
Hmm.
across printed media, videos, pictures, all the things. How do we tell those stories at the same time? Yeah. And then to this bigger point, right, which is why advocates tell stories, as opposed to
Right.
why human beings tell stories. Turns out it's about the same, it's the exact same thing. We're hoping to make a connection. We're hoping to guide people in terms of values and decision making. We're trying to get someone, usually the powers that be, to take a specific step. And as we've learned, storytelling is the most effective tool we have as advocates, as people who care about these things and want to see systems change. Storytelling is the most effective tool we have to move the needle on that. But one of the things as I did more and more of this work, right, you learn that there's actually a science to this, that there's, yeah, actually a science behind how people think and why stories land with us so effectively. In that journey, I think what I've learned is that the world is made up of chaos, basically, but individual actors, right? All of us out here making our individual choices and taking steps. But
Right.
the actions that we do, I think, are always made up by two components. It's first a question of how. In our
Hmm.
minds, we kind of chart out a map of, okay, well, what is it I need to do to get from here to there to accomplish whatever I need to do? And that's a whole other conversation about intuitively how we, right, construct a path to whatever
Hmm.
conclusion we want. But sometimes you have it in your mind, you're like, oh, I could do this thing, but you're just completely unmotivated to, right? The motivation is an important piece of action. Yeah, what is
Hmm.
it that like gets us from saying, hey, this is something I could do to something that we actually do? And it's this question of why that I think
Right.
understanding storytelling helps us to fill out. So, yeah, how do stories impact our why? You know, as we think about how stories work, right? I think
Hmm.
fundamentally they remind us of emotions. They help us to feel emotions that remind us of our values, right? So as I tell a story, and I think Dr. Geyer, when we've talked in the past, one of the examples I've used is I tell you a story about a woman who's worked the exact same hours as her male counterpart, and right, but she's earning significantly less. You hear that
Right.
story, and what emotion comes to mind for you?
Anger, unfair, outrage,
Yeah.
all of those. And I think being a woman, um, of a particular generation, certainly being interested in science, I was in the minority in many of my classrooms. And so there were some real inequities in my pay. So this is something that personally then I start to relate to because I've had some of the same kinds of life experiences.
Yeah. No, it's outrageous, right? And I'll
Yeah,
tell you, as a fan of women's sports, yeah, I am with you.
right,
It, but you're so right that you hear it and you can't help but react to it, right? Like
right.
naturally, you become upset,
Hmm.
angry. It's an injustice. What we've learned, right, is that that emotion is based off of a set of values that we all hold.
Right.
And the value in this situation is, hey, people should get paid equal for
Hmm.
equal work, right? Equal pay for
Right.
equal work is a fundamental value that hopefully most of us hold. And it's that thing, right? It's that at that value, that shared value. That's where stories land. That it both lights up an emotion in you, but as people process what that emotion is, what's driving it is the value. And
Hmm.
for my friends who are watching this who enjoy The Wire, it's like Bunk Moreland always says: a person must have a code. So yeah, that's what leads to action. It's that value piece, once we've told
Hmm.
a story that resonates with a value that someone holds deeply, that's what gets them to take the next step. Here's another illustration of that idea, right? I think this graphic helps to highlight kind of some of the baseline feelings that people hold that keep them from taking action sometimes. Whether it's inertia, which is a general idea that maybe it's easier to do nothing, or apathy, which is a lack of interest because you think something doesn't relate to you or impact you at all. Or there can be fear, right? That hey, if I step out and I rock the boat and it
Right.
isn't popular, then I'm kind of on my own here, right? And I think that also connects to this idea of isolation, which is
Hmm.
it's hard to act when you
Wow.
feel like yeah, you're out on an island. No one's like really standing with you. And to that point, self-doubt can easily creep in and keep us from taking the step. But that's where stories have the impact to spark a bigger emotion that overtakes
Hmm.
and usually cause, a bigger emotion that causes us to overcome that stagnation, I'll say. So it's to say that if you have a sense of what's holding people back, right, your particular audience, then you can tailor your story, how you tell your story, which stories you tell, who tells a story. It really helps you to hone in on those things in a way that makes it more likely that you'll be effective, right? So yeah, stories of impacted individuals can stress urgency. They can drive emotional connections that move people from apathy to anger. They can give people hope of what might come from their
Hmm.
actions, and that
Right.
helps them to overcome fear. And it can actually inform them in a way where they understand that they stand with a broader community of people, and that helps people to get over that isolation, right?
Hmm.
And then, yeah, anytime you hear the story of one person who's accomplished a big thing, that can help ease people out of
Right.
the self-doubt that can creep in. So, all that to say, yeah, there's a lot of that's the power of stories. That
Right.
like that's actually what's at play is that it's moving those things inside of us that we care about, but also those
Hmm.
things that are holding us back and moves us into action.
We've never talked about the role of social media uh, in the context of storytelling and advocacy. But as you were going through the list of words in associated with stagnation, and you were talking about feelings of isolation and self-doubt, and maybe there's an issue that's really important, but it's your issue and you don't know anybody else who's talking about, and you're on social media, and maybe the algorithm is giving you maybe a steady stream of people whose stories are very different because their experiences are very different, and so you wonder, well, gee, I'm just an outlier. But again, when you then meet other people and connect with other people to form coalitions and you collaborate with them, then you find that, gosh, I'm not isolated at all. And my situation, my story isn't an isolated incident after all. It's broader, and more reason for why we need one another.
Yeah, and right, I think that social media question is one that feels like it cuts both ways. It can
Right.
contribute to,
Yeah.
yeah, all the you can see a lot of heaviness that makes you feel
Right.
like, if I get involved, like what's the point, right? Like there are too many things working against me. But at the same
Right.
time, it can give you so much encouragement. And so maybe it's just proactively looking for those things that, yeah, that fill you, right? That give you inspiration, and to not just accept how difficult things are, to not accept,
Mhm.
yeah, just the maybe the negative stuff that gets put in front of us.
Right.
Yeah, great point. Um, you know, as we continue to talk about stories, there's also how to build them, right? What does it take? What does an effective story look like? What are the pieces of it? And that's what we'll talk about for just a quick second. There are three parts to a story that I'll cover overall. And it starts first with what we call the story of self, which is, the main story that you're telling. Every story, whether it's a Disney movie or you talking to your friend, has a couple of shared elements, right? There's an
Right.
individual, there's the main character, which I'll take a second to say sometimes it's you personally, but sometimes it's someone
Hmm. Right.
or maybe you're a provider and it's someone you've taken care of, right? But there's a central character or characters in this story. This individual runs into a challenge always, right? There's a decision point where something happens. And then there's an outcome. There's whatever choice was made, whatever action was taken in direct response to that challenge. And that story over time is the plot, right? And that just those elements are the story of self. So you have a person, you have the challenge that they faced. And again, if we're talking about in the context of healthcare, right? It's someone maybe who
Right.
couldn't get the medication that they needed and what outcome had, right? Like with that decision, what was the outcome? And sometimes I'll say there's no real decision, right? Sometimes someone just the decision is just yeah, you fall victim to whatever that barrier is. And that's just to say, obviously, an important part of the story. The second part of constructing a narrative is adding in what we call the story of us, right? And I think that's this moral piece when you connect the story to certain values and action. So if I tell the story about if I if I had just told you a story about someone who ran up against a barrier where they couldn't get the medications they needed and that was it, yeah, that would be a devastating story, but I don't know what to do with that. It doesn't take me far enough, right? But if I say, hey, this person ran into a place where they couldn't get medication, isn't that a devastating thing? We believe that people should have access to medications. That's at least connecting people to a value, right? Like just adding in that sentence. I'll say, right,
Right.
because yeah, we would love to for it to be intuitive, and for the most part it is. If you're talking to an ally, someone who like fundamentally gets it, maybe you can just tell that first part of the story and walk away. But if we're talking to legislators, decision makers, it's about getting them from understanding what the problem is to the final point, right? And so it's always worth just
Mhm.
throwing in a sentence or two that connects this individual story to the larger moral, the larger point, or the larger value that you're trying to connect them to.
I'm going to ask you a question that might sound strange. The mechanics of putting the story together, are there guidelines or suggestions for how to get started? I mean, do you write it down first? Do you record it and listen to yourself? It seems like, you know, I I work with a lot of students at the University of Florida who are hoping to go into health careers. And as part of their application, and you had to do this for law school, you had to complete a personal statement where you write about some experience that maybe has caused you to be interested in the career, and then what's happened in your life that has drawn you toward law or drawn you toward medicine or drawn you toward physical therapy. How do you get started? Because a lot of times, just if we want to write a story, just writing it down is a hard way to get started. What do you suggest?
We'll also get to the more practical bits, right? Like how we actually sit down and like do these things. But I'll say a couple of things to keep in mind right now, right? That in
Right.
this setting, different from a personal statement or maybe even a longer interview, usually in the advocacy space, you're talking about having a 2 minute opportunity to share your
Right.
story, right? Like, and that's
Okay.
the first
Right.
kind of parameter to work within is that it's usually a really short amount of time. And so you don't have long to get from the beginning of the story to the moral to the call to action, right? So all of that
Right.
has to happen pretty quickly. And so just to say that what I've also learned just in doing this work and like public speaking and things like that is that everyone has a different process. I have things that work so well for me, and then I try to pass that on, and you just realize that other people there's some folks who
Right.
write out, right, like word for word what they're going to say. There are some folks who love to just like jot things down in a point format, and there are other people who completely process it completely in their minds. And so I'll just encourage people to do whatever it is you feel most comfortable doing and kind of constructing the story. But just know that you have 2 minutes. You have to tell the story of self piece pretty quickly, right? So it's not so much about introducing the individual and telling their whole backstory. You'd want to give just enough context about this person and who they are, pretty immediately get into what the challenge is, what the outcome was, right? Where they find themselves, and then move it like quickly into the conversation about what this means for us as a community, as a state, whatever group of people you're talking
Right.
about. and then the action that you're hoping someone takes on the other side of that.
That's great because remember that those who will be listening to these master classes are either students in professional programs planning to go into medicine, or they're already in their medical school classes. And we also are providing for health professionals. So they're all familiar with this process of, the personal statement. So that you've distinguished between this kind of story and that kind of story is really a great point of clarification for us.
Yeah, no, and I know in this community, right, for people who like care about healthcare issues, we're all nerds, for lack of a better word. And so we just like
We
want
are.
to talk about it, and that's the hardest part sometimes, just reining ourselves in. Uh, but yeah, just to say, know that if you hit these 3 points, that you've done the job. You've told someone the story yourself, the thing that's happening to someone that highlights a problem. You've invited other people into your community by saying, hey, this isn't a thing that just impacts this person, that it's a larger problem that's happening throughout the community, and a lot of people are faced with it. And maybe this is where data is highlighted, right? It's in
Right.
this telling the story of us. But then finally, it's that last piece of saying, hey, here's what I need you to do about it. It could be asking a legislator to vote, but to vote for a specific policy one way or the other. But remember, there's any number of steps you can ask someone to take. For
Mhm.
instance, as we've been working on Medicaid expansion here in the state for a long time, we also meet with our allies and people who we know are already supportive of it. But what can they do in a legislature that's like, yeah, that's pretty opposed to it and they have a super minority? They can help connect us to other movers and shakers, right? Hospital systems or other people who might have influence with those legislators. So just know that in whatever setting you are, definitely tailor those asks, but that
Mhm.
they go beyond sometimes just voting for your particular piece of legislation. Yeah. And then avoiding the pitfalls. We talked about this a little bit, right? It's funny enough, this is 3 long bullet points basically telling you to keep it short and concise. Yeah, tell a story, not about the story, not like, hey, here's this person who did all this, and this before you get to the challenge. Just very quickly get into who that person is, the why it matters. So, hey, here's a single mom who is working 2 jobs, right? Like that gives you a clear sense of who we're talking about. Yeah, and get right into the challenges and move on from there. As you go into these settings with legislators, right? Whether that's a sit down in person meeting, maybe you run into them in the elevator, maybe it's a virtual meeting, right? I think there's there are things you can do to prepare yourself to be really ready for that moment. One, it's knowing who you are, knowing how you speak, your own story. You already have that like tucked away. You know what it is you want to share, but know those things about you and how you want to tailor that in the conversation, right? Know which points
Right.
you want to hit on. Know your audience, whether that's people in your circle, whether those are your champions or your opposition. Know the kinds of things that, or try to anticipate what might come up, right? What they might say in response in a way that you kind of build that into your story, right? Like before you start talking to them, you can kind of cut some of I don't say cut them off, but you can anticipate what they might say and just lead with that. And then knowing your issue. On this point, I'll say just to echo your earlier thought, Dr. Guy, about the value of coalition, right?
Right.
Sometimes you're just the storyteller. You're just the person with the lived experience. I say just, but that's a pretty big deal to go in
Right.
there with just your experience. But then you have someone else in your coalition who's the policy wonk, who's the person who can do the back and forth on the policy. And I think that's the value of coalitions, that everyone can bring something to the conversation. And so if you walk in there together, you only have to worry about the parts that you're responsible for, right? And you can leave
Hmm.
some of the other
Right.
pieces to other people. Yeah. But I'm sure people are thinking, Scott, this all sounds great, fantastic, but does it work, right? Like what does this even mean? What does it even do? And I'll say that, I'll get to the big finish, but just a couple of quick examples of pretty impactful moments for me myself as I was coming up through the advocacy space. Uh, 2014. the political atmosphere was pretty charged, not as charged
Right,
as we're in today, but Florida at the time, especially, yeah, it was tough. Especially considering the conversations we're having around immigration back then, it was still a pretty
right.
hot button topic. But there was the Dream Act for young undocumented immigrants to receive the same in-state college tuition rates. There was an effort to get that done, and it was a group of students who went in with he wasn't the speaker then, Will Rutherford, and in that initial meeting with him, they said, "Hey, we would. This is a thing that's important to us, right?" And just a
Hmm.
couple of students
Right,
really like moved him very quickly in the setting. And he made him a promise that day that, hey, if he was ever in a position where he could do something about this, that he absolutely would. And sure enough, that's what he cited when he became Speaker of the House in 2014 for a Republican in Florida to pass the DREAM Act for undocumented students was a big deal. But he specifically pointed to the impact that hearing stories had on him in his office that like stayed with him for a long time, right? And I'll make this point again, but sometimes it's just about planting the seed that we shouldn't
right.
expect that we walk in and our story immediately changes someone's mind and we feel so vindicated. I think 99.9% of the time our story is just planting a seed or watering a seed that's been planted before, right? That we're just a little part
Right.
of a larger thing that's happening. And that makes it, I think, having that expectation going in makes the whole storytelling bit feel, yeah,
Mhm.
it's a little less pressure on ourselves.
And I think that's what makes advocacy easier because you take the pressure off yourself because you don't expect that it's your sole responsibility for putting the story together, building the relationships, spending time to meet and educate and, work with the lawmaker or policymaker. It's a shared kind of experience.
Yeah, and it's a tough thing to get up to. I think about our folks who make this trip up to Tallahassee every year, right? Like we have folks who drive from
Right.
Orlando or South Florida and they go the 6, 7 hours up to the Capitol. They, get shuttled around all day in these different meetings. And sometimes it
Hmm.
can feel like
Right.
you're not being heard or you didn't walk out of there with the legislator being like, okay, I'm in it, I'm doing it.
Right.
And without, if you go in with the expectation that your story is going to like have this big moment, yeah, you can leave a little deflated. It's so easy to leave a state capital anywhere. It's so easy to leave that setting feeling deflated. And yeah, that's we try to prepare our folks to understand that that's not the way these things work, but
Hmm.
it's
Right.
it's the most human thing in the world, right? Like you totally understand that the disappointment that can feel like sometimes. But to see the way it works, that it actually can work for people, it can work for different issues. And what's the saying from Dr. King that the arc of history bends towards justice? It's a bending, and our stories are
Right.
helping to do that bending that over time gets us where we need to be. So nothing is lost, right? Like by
Hmm.
whenever we
Right.
share a story. We're also up in Tallahassee each every week of session. So we have a 60-day session, ends up being 9 or 10 weeks. We have one group that goes one week and they leave. But what they don't see is that there's another group the next week following up, echoing those same things, and the group after that, echoing and follow. So, yeah, when I talk about all of us doing this together, that's another example of it, that each of us
Right.
in our time and in our place, we're doing our bit, but just know that there's a larger community of folks who are also pushing in that direction. And together, yeah, those seeds one day will grow.
I'm going back to your word picture of the bending process. You know, you can bend too quickly and then you get a break.
Yeah,
Um, the bending process is about controlled conditions, right? And
absolutely.
so there's a timing in the bending process. And I think sometimes we become impatient. Um, but I'm gonna hang on to that bending. I mean I see a piece of metal in my mind's eye, kind of bending.
Yeah.
And I'm trying to cement that image to my concept of advocacy now, and the fact that it is a process that takes time. over time. Sometimes heat is involved, right? Sometimes heat is not a bad thing. Sometimes heat makes the bending, a little bit smoother and easier. So I think there's an awful lot to be. I could probably work that this word picture for quite a while. I won't, because I know you have other things to talk about. But again, just the patience and the collaboration and the partnerships is really important.
Yeah. And I'll say just to acknowledge that the tough thing about that, right, is over as time elapses, as we're trying to fix
Right.
a system and time is moving, I guess there's a privilege for some of us in being able to say that because
Hmm. Right.
we have enough to kind of get through that period of bending.
Right.
But there are a lot of people, the hard truth is that there are a lot of people who are still suffering in the meantime, and we do what we
Right.
can to alleviate that.
Right.
And to alleviate that for those folks immediately while
Hmm.
also pushing towards this bigger thing. But it is to acknowledge that as we're working on that bending, that it does leave a lot of people vulnerable. And so it's okay to feel that like,
Yeah.
hey, we also need to be doing something now. And yeah, some of us are working on that part of the equation. Some of us are working on the long-term bending, but
Hmm.
together we're all fundamentally doing the
Right.
thing. Yeah. As we talk about kind of serving people and their acute needs, here's just an example of storytelling that I've found to be, yeah, really fascinating to me. And it's the Rural Women's Health Project here in Florida that uses, and I think it's become a popular concept now, but in Florida, RWHP I've seen do it the most effectively. And it's the use of these fotonovelas where
Right.
they tell stories through, and you'll see examples of it. But they tell these stories about different health conditions, health access issues, things like that, how to get healthy, how to access certain services using community actors telling a fictional story, right? And it's
Hmm.
yeah, I don't know why. I know why this example speaks to me. It just feels like it does the thing really well of getting to people, meeting people where they are.
Hmm.
Which is, yeah, I think maybe the one of the underlying themes of this whole storytelling
Right.
presentation. It's working really intentionally to meet people where they are. And so, yeah, as we try to engage people in advocacy, as we try to meet their needs for the things that they need now, know that storytelling can be a really effective tool in that setting as well. That it's not just the systems, the broader policy systems change stuff, but even community change, right? Like community behavioral change.
Right.
Yeah, that storytelling has potential there too. So I'll land the plane by saying just by yeah a couple of things to keep in mind. That first, you don't have to be connected with an organization or a larger partner to do storytelling. Again, everyone has a story, everyone has a perspective that I think matters and adds something to the conversation. And so know that you as an individual, if you're in between partners or you're looking for a partner, right, that you can still use your story for yourself. You can still do that outreach to legislators. Yeah, I hope you feel empowered to do that, to go talk to the powers that be and say, hey, here's the thing I'm seeing. Here's a problem that needs fixing. Here's something that we can do about it. As you like also plug into the larger advocacy that might be happening around you. I've mentioned this a couple times, but you don't have to be the person directly impacted. You don't have to be the person who can't access care, right? Like you could be a neighbor. You could be a doctor. You
Hmm.
could be just
Right.
someone, a fellow churchgoer, right? Wherever you are in that equation, that might be where the legislator is, right? Like maybe they don't have someone who's directly impacted, but they sit in a congregation with folks and hearing your story makes them go back. Maybe the next Sunday they're in church, they're looking around and they're saying like, oh, look at what's happening within my community. I've never taken this deep a look. So you just
Mm.
never know which
Right.
piece of your story is going to connect with the person you're talking to. Uh, sometimes though, you come across an individual who you think to yourself, like, hey, this is a really effective story, a really powerful, compelling story that it would be great for them to share for themselves. And I think part of what you can do if you're not the person who's comfortable sharing, feel free to gently encourage others to get in the mix, right? Like
Mm.
remind them that maybe they don't know that their story can have power and they just need to hear it from someone. So in that way, you're contributing to, again, this bending of the arc. And then yeah, if I leave you with nothing else, it's just to keep in mind that sometimes our story, most times, our story is just the seed that we're planting, or we're watering a seed that's already
Right.
been planted with someone, right? That it's just a small part of the equation, but not an insignificant one. Uh, I'll close there. I'll leave you with this exercise, right? Which is kind of just some bullet points for folks to begin drafting their own stories, right? If you're looking for a starting place. Yeah, here's some questions to kind of ask yourself as you're jotting down your notes. And then, yeah, like Dr. Guy mentioned, do the weird thing. Do the weird thing and get in front of a mirror and like say it to
Right.
yourself, right? Like that's, I think, an effective thing. Or right, if the walls are thin where you are, get in your car and like say it to yourself if you're preparing to share your story in one setting or another. But I imagine these will be shared so people can have access to it and can kind of spend time crafting their own story. Uh, I'll stop there just to say thank you for the opportunity to share this and looking forward to, yeah, doing this work together.
So, Scott, if the walls are thin, here's what you want to make sure you do. You want to tell the story in that space. And when you finish telling the story, you want to ask the folks in the next room through the wall, hey, you have any feedback for me? How could I improve that story? Um, that's
Yeah.
the one thing in the model that we often leave out is getting feedback from somebody about the story. How could we make it better? How could we make it more clear? What I love about Florida Voices is that on your website, you practice what you preach, and you have a bunch of stories from people from all different priority populations with different kinds of healthcare needs and access issues. And you have their stories as both videos and written stories. Um, because I'm an educator, I thought that was a real valuable thing to pass on to some PA students at the University of Florida. And so we started telling our patients stories. That's actually called narrative medicine, telling your patient's story. And so, again, for the health professionals who will listen to this presentation for continuing education credit, I think it's important for them to think about how they could use the space on their website or on their practice to not necessarily give me a rating, okay, with Google. Go ahead and tell a little bit of a couple sentences about your experience. Certainly, that's much more powerful, I think, than 5 stars or 3 stars, don't you think?
Yeah, no, absolutely. And to your point about feedback, right? It's a scary thing to do. It's a scary thing to have somebody else like listen to you and offer
Yes.
thoughts back. But that's really how we sharpen ourselves, right? That's how we tell the most compelling version of the story possible. So yeah, you're spot on.
Well, Scott, thank you so much for joining us and inspiring us to take steps, maybe first steps for some, to get involved with advocacy, which is education, and telling our stories to change systems. Thanks for joining us. I hope you enjoyed this masterclass series and are feeling empowered and a little brave about stepping out to engage with advocacy. I hope you'll join us for our next class, which is all about literacy with Alyssa Hobart. Stay tuned.